on this computer. Good morning. We are doing a Thursday morning early update with our buddy from BCHIP, Kim Everett. Kim, how are you?
Good morning. I'm good. Thanks, Jennifer. And how are you today?
We're good. I like this early morning thing. My hair looks good. There's not like all this pressure. Anyway, we are coming to you on Thursday morning, which is a little off for us because Kim just had a monumental experience these last few days with the good folks from, well, the county as well as the Blue Zones. So, Kim, why don't you start off reminding everybody what the Blue Zone Project is?
Oh, so Blue Zones is a program around, and I go, oh, because wow, it was a really intense few days, but what an incredible experience. So Blue Zones we talked not too long ago about areas around the world where people live better longer. And so they are an organization that has found the science or found the keys to what they believe is living healthier for a longer period of time, and where more people in the world are living to be over 100. Um, when I started this process, none of it is true rocket science. It's about more plant-based more plant-based diets. It's about being more intentional about movement. But it's about having purpose and connectiveness with folks. And so what they've learned to do is to take some of the principles from the places where people live better, longer, and try to apply them to local communities. So I'm working with Senator C. Santasiro on this project. And so he was able to secure some funding for us to move forward with the first phase of this project. And the first phase is what they call Project Ignite. And they bring their subject matter experts from all around the country to Bucks County and to do an evaluation and to meet with community leaders and to ride around the community and look at our community here. And it was a pretty incredible experience to do that with them.
So you just did that over the last 3 days, correct?
Yes. Oh, what did I just do? Did I lose you?
No,
I'm
you're
sorry.
fine.
Okay.
There's always a fun technical glitch. Get through it, right?
Always.
So what
Always.
happened during the last 3 days? You guys roamed around Bucks County doing what?
We did. So the experts, they bring people to our county. They are food policy experts, tobacco and alcohol policy experts, built environment experts. So we got on this van with the senator and his team, and we started on day one by driving around the lower portion of the county, south of Route 1. And so we went to Falls Township, and we went to Bristol Township and Bristol Borough and Marsville. And we drive them through communities, and they're looking at things like sidewalks and trails and not just that. They're looking at the tobacco shops and how they're able to market, or how close they are to our schools, or what they're near, they're near the ice cream shop, right? Which is kind of interesting, right? Things like that, how are they promoting their signs outside, and should we have different rules around things that are encouraging kids to vape and smoke versus trying to limit where they can advertise. So they're looking at not just the parks, but because movement is really important, but how can we build movement into everyday activities, so are kids able to walk to school? We did 2 keynote addresses Monday and Tuesday night. One was down at the wharf, and we had about 60 people attend, which was pretty incredible. And then the second night we were at the community college, and we had close to 200 people attend. So Jen, I just have to tell you, I've been doing community health in Bucks County for 30 years. I hate to admit it, but yes, 30 years. And I can tell you that if I was to tell folks I'm going to pay you $100 to come learn about how to be healthy, I couldn't get 200 people in the room in the last 30 years. Blue Zones has this incredible brand, and it's incredibly comprehensive. And I think it's the comprehensiveness of the project that really is getting at least my attention and others. They go to restaurants and they ask for samples of their menus.
Yes.
They are looking at our farms. They're looking at our school policies around food. They're looking at how do we incentivize restaurants to make the healthy choice the easier choice. So no one's saying we're going to, take away French fries, right? That's not it. And everyone has their right of personal choice. So Blue Zones isn't about taking away personal choice, but they're trying to make the healthier choice the easier one, if that makes sense.
Yeah, that is awesome. I know, we eat out on the weekends like many people do around here. And you go to a restaurant, and I'm actually starting to pick restaurants where I know my friends who don't like healthier choices, they can get their burgers and fries, but I can get a salad. The problem is, do you really just want the same old salad? Do you want the same old piece of salmon? Do you want, like, what are those healthier choices that we can be making? I'm sorry, that restaurants can be offering, because that's a huge part of it. You wake up Monday morning and you're like, ugh, I just ate all that gross food all weekend. And it
Mhm.
really does impact you.
It does. It does. And what's nice is um, they have, they do have recipes and things online. That's the other thing they really focus on, is how do we make healthier food taste well, right? And really making sure that we want folks to make that choice, and sharing recipes with our restaurants and encouraging them to explore, how they do that as well. And they're not just looking at menus, they're talking about sourcing of food. So where are we getting our food, and is it nutrient rich? And how do we encourage them to work more, our restaurants to work more closely with our local farmers? And how do we encourage our local farmers to work more closely with our restaurants? And so there's just layer upon layer upon layer of policy involvement in this work that's really interesting, and can be really impactful to people's health in the future.
Yeah, it's fascinating. I have done a lot of research now on the Blue Zone since you and the senator have brought it to light in Bucks County. And one of the things that has always shocked me about Pennsylvania, and really, areas that I've lived in, is that there can be food deserts, right? So
Mhm.
as everyone knows, I've spent some time in Pittsburgh, and I was actually living by the college in a food desert, because there was there were a couple convenience stores, a couple smaller groceries, but you have to drive to get to any substantial food, like, supermarket. And I
Mhm.
remember when my daughter said, "Mom, this is a food desert." And I was like, what is that? We're in Pittsburgh. Like, what are
Yeah.
you talking about? And then you've
Mhm.
brought to light through the Blue Zones, and if you read their information, that if people don't have access to buy healthier foods, if all they have is, a convenience store down the street that doesn't even have, fresh vegetables or an apple,
Exactly.
that's going to impact their health in a negative way. And then, to your point, if all they other else if they always walk past the vape store and they have no
Mhm.
connection to other people in their lives, so this is like, it's a cycle of, making some not so healthy choices. And I think that that's the beauty of what the Blue Zones bring to us. So were there, I know that they're going to do a big report, were there any preliminary kind of,
They didn't share anything like that, but it was kind of nice. And oh gosh, I keep hitting some buttons. I'm so sorry, Jennifer.
you're doing
Okay.
fine, you're not, it's not impacting the video at all.
Okay, good. Um, so they didn't really share any results with us, but just being on the bus with them and riding around and doing that work, I can tell you there were things that I noticed, right? Just as someone as a public health professional, that it was like, wow, this is really neat to be able to ride around and look at our community and see opportunities. Some kind of like I mentioned already to you, just opportunities to work with restaurants, whether it's actually Blue Zone project or not, but to be able to say to them, hey, how can we be more intentional about connecting you with our local farmers, right? Or how can we work with some of the local municipalities to say, hey, maybe we shouldn't let the signs for the vape flavors be next to the ice cream shop, right? I'm not exactly sure what all the next steps are for that, because truly my brain is just spinning since spending the last few days with them. But I can tell you that seeing some of that opportunity or things that I can bring back, to our team here at BCHIP and say, are there pieces of this that align with some of our work already? Like certainly, we have tobacco settlement funds that lead our tobacco cessation program. So decreasing, access or trying to make healthier choices or policy around that work is certainly aligns with some of the work that we do already. And we have resources to do that. So that's just an example of something that we might be able to engage in a little bit moving forward. parallel to the Blue Zone project moving forward.
Sam, so you
So
seem a little energized about this. Like, it was
yeah,
like going to a conference and coming back and you're like, yes.
yeah, that's exactly what it's like. Of course, it's exactly what it's like. I love that you put it in perspective like that. It's when you go and because what I loved is that Blue Zones validated a lot of the work that we do already. Truly, we have a lot of good stuff going on in Bucks County, and they were very impressed by some of the work that's already done. And they were very complimentary of BCHIP and the work that we're doing here as well. So it validated that the work we're doing is on target. So that's always good, right? To kind of validate that what we're prioritizing is important. So that was helpful. And certainly it energized me to keep doing this work, to find other ways to do this work that can be impactful in our community. And so I did share with them, I said, look, when we were saying goodbye last night, that we had wine at 5 because it's about connectiveness. Yep.
Well, and that's a Blue Zone. One of the tenets of the Blue Zone project, there's a specific wine that they have found that people drink in these populations where everyone lives a long time and are healthier. And I was like, oh, what's that about?
Yeah, I think it's something about, they did talk about this, but only briefly. It's wine that where it's actually pressed with the skins and things of that sort, or it's made with
Okay.
and so this way we didn't take all the oxidants or antioxidants out of it, and but that's not what we had last night. We had local wine that was donated for the project.
Neat.
And we got to go to Bowman's Wildflower Preserve, and that was just beautiful. So as someone who's lived and worked in Bucks County my whole life, I loved being able to brag and show off the beautiful things that we have here in Bucks County, because we have a beautiful county and we do have lots of great township and county and state parks. And so it was fun to just, to brag and show off our community to those folks. And Bowman's was certainly one of the things we got to show off.
Awesome.
Yeah.
Okay. What else you got to tell us? I mean, that was a lot.
It is a lot. I guess what I would say is certainly for folks that are listening, I'd love for everyone to check out the Blue Zones Ignite project. Start thinking about how people in our community can be engaged in this work. Next steps for us is we're going to continue to work with the Blue Zones team for the next few weeks to see what information they didn't get when they were here and make sure that we get that to them. And then, yes, they kind of go away. I was teasing them. I'm like, please go away for just a little while. We all need to get back to the work we did before you were here. So they're going to go away and they're going to come back with a report and make recommendations for us. And then the big challenge for us, is that big pink elephant in the room. Who's going to pay for it? And so we need to find some folks in our community that are committed to health and wellness that might be interested in supporting this project moving forward. And we have to determine, do we have the ability to do that in Bucks County? And that's to be determined. But what I did say to the Blue Zone folks as we were leaving last night is whether I secure the funding for a comprehensive Blue Zone project or not, just their presence here in our community for a week will have an impact on our community. I'm completely convinced and committed to that. So it was exciting to be a part of this work.
Yeah, it's so exciting too, because so much in healthcare these days is about what we do when people get sick. How do we manage those disease aspects of it? And they're kind of coming in at it from the other side of
Exactly.
that's important to have those systems in place, your partners, the hospitals, all of those services that are available, certainly in Bucks County. But then also, how can we all live healthier lives? It's a beautiful marriage with what BCHIP already, the people that you've already put in place, your partners. It's like a beautiful addition to that work that you guys do.
I agree. And what I loved about it is I think what BCHIP is always committed to is connectiveness and connecting the dots. And Blue Zones really shows that, one of the things that, and I know we were kind of wrapping it up, but this came to my mind, I want to tell you about it is, loneliness is actually a greater health risk than smoking. And someone who feels isolated is really going to experience typically more health concerns than someone who smokes. So post-COVID, as so many of the world is still, and so many people in our country are still struggling to reconnect, we really need to be more intentional about providing opportunities for people to connect. And so that was one of the messages I took away too. When you say I'm energized because I'm like, wow, that to me is the primary prevention for our mental health problems here in our state, our country, our community, right? Not that we're going to get rid of substance use disorder or mental illness by connectiveness, but boy, it's a big piece of it, right? So how do we get people more connected and feeling that they can have people they call and can talk to with good information and in times of struggle? And so being intentional in that work, I think, is a lane that BCHIP is excited to start to explore a little more too.
Yeah, and as you know, I have 20-something-year-old daughters, and both they who are moving to different cities and doing different things. And one of the things that they have done is explored exercise opportunities where there's also a connection. So just, as a joke, my daughter last night is in law school and knows that she's graduating soon and doesn't just want to hang out with lawyers. So she went
Okay.
to a running club and they ran 4 miles. I'm just saying, this is not my cup of tea, right? This is hers. So we all don't have to go out and join a running club. That would be great, but it's not possible for some of us. But that, and I said, wow, she is picking up on that connection. And if you look
Mhm.
around in towns and cities, well, you and I could start a hot girls walk if you've
Sure.
heard about those. But it is
Yeah,
that connection. It's getting together and, having people to talk to, because with
exactly.
so many people working at home or running their own businesses or
Hmm.
staying in, it's so critical. So little things like that can make a difference. And as I always tell people, go on the hot girl walk. And if you don't like it, you don't have to go back.
Exactly. Exactly.
But well, I had
Um,
no idea that connection was so high up on the list. It's fascinating work.
yeah, it
Fascinating
was really
info.
interesting. So certainly more to come. I'm hoping that those that are interested will check it out. If you're not familiar with Blue Zones, if nothing else, just check out the principles of it. I think there's something for all of us to be able to learn there personally. So we'll see what's next in this work for us here at BCHIP in Bucks County.
Great. Who knows what you'll come up with by next week? This is exciting.
You
Okay,
never
guys.
know.
Well, we will see you the next time that I can grab a half hour on Kim's schedule. She's very busy working for our health with her team at BCHIP here in Bucks County. And we will see you next time.
Thank you.